are you looking for? I got that. I can do that for you. Cool. If you just want to make yourself comfortable right there, I'll just put my gloves on here and we'll get right into that. So, tell me a bit about yourself. All right. I like. What else? You don't say. I actually went there last week. I wasn't too much of a fan of it, but if you're saying it's good, I'll give it another shot. Alright, now that we got our gloves on, I'm just gonna throw my music on. Actually, no, I won't do that today. You're a special client, so I'll keep the music off. But let's get into this. But before we get into any haircut that I ever do, I gotta have my drink with me. My Stevia Cola. No sugar added. Alright. Now, before we get in, I'll have a couple sips, and then I'll get you going, my friend. Alright, just have a seat. Here we go. Now, were you wanting like a full fade, or were you wanting like a taper? You're going for the fade, okay. So I'll just be starting around on the outsides, getting that level of where I like your hairline to be, starting with the fade there. that. So let's get back into this. Whew, working up a sweat here. Nothing like a cola during a haircut sets you right. So just stay super still. Gonna come along and do the top front of your hair here. Just up the sides. Okay. Cheers. Coming back in. Got the final ones here. This will really create that fade-like look. So just be super chill. Exactly what you're doing. Nearly done. Just getting the last little stragglers here now. Okay, just taking off the guard completely. Just gonna go along that back neckline there, so just be still for a sec. Okay, so let's get that mirror out for you. Okay. What do you think? You like the backside? You saw that little zigzag that I put in there, right? Don't tell anybody, but that's for the unique client that you are. Just one sec. Alright. So, Margaret will see you out in the front there. Give you that 50% discount today, so that actually makes you have to pay 1 penny. Don't tell other clients. I'm just gonna throw my tunes back on and clean up all this mess so you have a stellar and spectacular day, alright? Hi there. Thanks for waiting. I do apologize. Our clinic is just swamped today. But thank you for coming in, and it is now your turn. We'll be doing an eye exam today, is that correct? Great. I am Dr. Talk. Dr. Whisper's not able to make it in today. He's feeling unwell, so he's asked for me to step in to do this exam for you. So we'll be going through a multitude of examinations today, steps of seeing how your eyes work, testing your reflexes in regards to your eyes, how you see both near and far, and at the end of it, I'll give you a prognosis on how I believe your eyes are. How does that sound? Excellent. So the first thing that I need to do is just going to write down a little bit of information that I'm going to get from you. Okay, I'm just going to go over your birth date, your name, and everything with you so that I can make sure that I have the correct patient file in front of me. Can you let me know your name? Great. And your date of birth? Great. And your approximate weight, has that changed recently? No? Okay. Still the same? Okay, I do apologize. We do live near an airport, so let's just pretend like we don't hear helicopters or planes going over us at these times, but that's just the way it is when you live in a busy city, unfortunately. So again, like I said, you've given me your weight and your height. That's still the same? Great, that hasn't changed. Perfect. Any dietary restrictions that have changed since you've last been here? No? Okay. Prescriptions, medications that you're taking? No? All right. Anything else I need to get in here? Any recent surgeries? Great. And just overall, how do you feel like your eyesight has been since I've seen you those last 6 months ago? No changes? Most people get an eye exam every 2 years, but seeing that just on your past recent medical history, Dr. Whisper has requested to have it done every 6 months. So we'll go through an array of examinations to make sure that it's still the same and hasn't gotten worse since the last time that you were here, okay? All right, just gonna write down a couple of extra pieces here. Great. So the first thing that we need to do is I'm just gonna have a peek inside your eyes, okay? How does that sound? Great. So I need you to just open your eyes nice and wide. I need you to see this light, this pen light. I just need you to follow it as I go up and as I go down, from side to side, both left to right and right to left, okay? Great. So when you see the light, let me know. Great. Let me know when you see it again. Excellent. And let me know when you see it again. Great. From the outside, and excellent. So peripheral vision looks to be great. A couple more examinations I'm going to do before we get really deep into it here. I need you to let me know when the light, the pen light, both comes towards you and away from you. Very simple, but it's part of the examination. So, is the pen light far or near? Great. How about now? Far or near? Great. Was it clear when I was close to you? You're not sure? Okay. So tell me, does the pen light and my hand get clear or not? It's clear? Great. Am I in focus? Excellent. Now back here, can you still see that pen? Is that in focus for you? Excellent. Your peripheral vision, you are both far and nearsighted, is great. No changes there, so I'll mark that down in the book. Get to that page. Okay, so far-sighted, still the same good. Nearsighted, still the same good. Peripheral vision, still good. Excellent. So far, things are all looking great. So I'm going to be coming in again, but we're going to be doing different sequences here where I ask you to tell me when you can't see things anymore, okay? So we'll be starting, instead of things coming into your vision, they're going to be leaving your vision, and you're going to let me know when you can't see them anymore, okay? I've got 2 pen lights going. So tell me when you cannot see the lights anymore. Can you see them currently? Excellent. Tell me when you cannot see them. Great. And again. And again. Excellent. And again. Excellent. So both top and bottom, left and right, excellent in regards to things leaving your vision of field. We're going to be going into the corners of your eyes, up here, down here, and down here, all right? Okay, so tell me when you can't see them anymore. Great, and again. Excellent. I like what I'm seeing so far. As you can tell, it's a beautiful day outside. That window behind us is just bringing in so much light. I love it. Okay, let's update that booklet again. So, both axial on the x-axis is good, and the y-axis is good. So far, Dr. Whisper's going to like what we're seeing so far. No changes in your eyesight. Now, we're going to be covering one of your eyes, and we're going to be looking at it in regards to, do you have astigmatism? Can you see properly out of one eye, the other eye, which then gives you good focus on both eyes. So I need you to close either eye, just so that I can make sure that we're closing the correct eye. I'm going to get you to close your left eye. I will put this over your left eye, and you let me know if vision goes blurry or if it's sharp, okay? All right, I'm coming in here. Let me know if you can still see properly. Can you see my face? Good. And is my face clear still with this in front of it? Great. We're going to do the other eye now. Now, going in here. Is my face still clear? Looking at your right eye here, is my face still clear behind this item? Great. I like what I'm seeing there. So, no problems there either. That's, so far, I like this. You're a good patient. You take care of your eyes. Do you eat carrots? You don't? You must just have good genetics then. Okay, so with the tool both forwards and backwards, I'm still clear in the background with the item in front and the little right eye. And I am still clear on the left eye with the item in front. Great. Now we do have some new items here that we've come into. They're very high tech. This is an optic red laser eye scanner. So, very high tech. I'm going to be putting it in front of your eyes, and I just want you to look up and then look down when I put it in front, okay? So, can you look up for me? All right. Looking up, then looking down. Other eye, looking up, and looking down. Great. That's step 1 of this machine. It can do multiple things. That was looking into the back of your retina, making sure that it's intact and it's still attached. Now, we have all this new technology, which is great, but it's always good to go in and do manual checks with the light because my eyes can physically see what I'm looking at. So I just need you to look up for me, and I'm going to come in and look, okay? Okay. I like what I'm seeing. Coming in with the other eye there. Looking up there, please. Great. And down for me. Okay. Looking. Okay. Other eye. Down. Okay. I need you to make your eyes as wide as you possibly can, okay? I'm going to be testing your dilation, your pupil dilation. How is it reacting to light? Okay, so eyes nice and wide. I'm going to come in with the light. Great. Coming in again. Great. One more time. Excellent. I'm going to be coming into your right eye now. Coming in. Great. One more time. Final time. Okay, you can blink now. Sorry about that. I just need you to have your eyes as wide as you can so that they let in as much light so I can see how they react to my pen light. Okay, let's write down that information. Left eye reactive to light. Right eye reactive to light. Okay. Just gonna get a little close in here. I'm just gonna feel around your eyes, okay? Alright, so if you can just, is it alright if I do that? Okay. I'm just gonna come into your left eye here. So just keep your eyes open. I'm just gonna be feeling around the outside of your hand there. And the other side here, just feeling around the eyes. Okay. I'm just gonna feel underneath the just underneath the eyes here, okay? On your, okay. Okay, just look up for me, please. Just gonna pat underneath the eyelids there. And patting under the other eyelid. Great. No puffiness. How have your eyes been for redness? Are you getting enough sleep? No puffiness in eye right. No puffiness eye left. Great. Now we're going to do our eye test. We've got our standard sheet here. I need you, when I point to it, to tell me what letter you see, okay? All right. What letter am I pointing to? Great. How about this letter? And this one? And how about this one? And this one? And this one? You could read those all easily? Great. How about this number? And this number? And this number? Great. Let's go a little bit farther down. We're going to read that. Can you read that number to me? Great. Can you read that letter to me? How about that letter? How about that letter? That one? And that one. And the final one. Great. Now we're going to get a little bit to the very small writings. If you cannot read them, that's okay. Our eyes can only see so good. All right. Can you read that letter for me? How about that one? And this one? And this one? And this? And that. Great. What number is this? Excellent. 20/20 vision so far. I swear, you must eat carrots. Because you can't have vision like that without eating carrots. 20/20 vision. Eye chart. Excellent. You're going to get a gold star today. Dr. Whisper is going to be so proud of your eyes over the last 6 months. I really like what I've been seeing. We're going to come back in with our high-tech tool. It's just going to do a quick laser looking into the very back of your eyes. So just stand still and try not to move. Okay, tell me when it's in focus for you and then we'll start the exam. It's not in focus? Okay, how about now? How about now? Really, your eyes are not focusing. Let's try that again. Is it focusing on you? There we go. Yeah, sometimes the eyes take a little bit longer to focus. So I need you to look up. Okay, and I'm just going to tilt the camera looking down into the back of your eye. And we're going to start the exam. Stay very still. Great. Okay, we're going to go looking up. I need to look up. Great. And same thing again, looking down this time so I can look into the tops of your eyes. Ready? And hold still. Excellent. Let's see what that machine tells me. Okay, so that's looking good. A plus. At least if it could give an A plus, that's what you would have got. Let's put that cover back on. This is a very expensive technological tool that we have. So, put the cap back on that. We'll write down the last little bit of information here. Laser shows no macular degeneration. Eyes are excellent. Seeing capabilities. Now, before we finish up this exam, do you have dry eyes ever? You don't? Okay. I was going to say, if you needed some type of prescription, I can always give you something if you get dry eyes. We are coming into spring. We are coming into allergy season. But if you don't have allergies, we won't worry about it. Great. Okay, so the last and final test, just before I let you go here. Just a simple color test. I'll hold the pen light up. You tell me the color that it is. Once that's done, I'll be able to let you go. Okay, so I'm going to put this pen up. Tell me when it's in focus. When it's in focus, let me know the color of the pen, okay? Okay, so can you see the pen? Great. What color is it? Excellent. On to the next pen. Only tell me the color once it's in focus. Okay. Here we go. What color's the pen? Great. 2 for 2. Again, wait for it to focus. Wait for your eyes to focus. Is this one taking a little longer for you to focus? Let's see. There you go. Did your eyes focus yet? Great. 3 for 3. Wait for your eyes to focus. And wait for your eyes to focus. Great. 4 for 4. On to the final one. Wait for the focus. Did you get all the colors? You did. Great job. Let's put those in our notes, and then I'll be able to put you up to the front desk to speak to Margaret, and she can get you in another 6 months. Color test. 5 for 5. No color blindness. All right, see patient 6 months from today's date. Great, you're all done. You can go see Margaret at the front. She'll book you in 6 months' time. You may see me, Dr. Talk. Dr. Whisper may be back to be doing the exam for you then. It's been wonderful seeing you. Be safe and have a great day. Take care. Bye-bye. I'm so excited that you were able to make it to this appointment today. This facial will be like none other that you've ever experienced. There are a multitude of procedures that I will do to make your face glow and be radiant when you leave today. So, without further ado, let's get into this exam. So, the first thing that I need to know is, can you give me your name to make sure that I have the correct patient? That's you. Great, thanks for giving me your name. Now, you picked the extreme exfoliant, is that correct? Good. all set up here, so I just need you to let the stress fall off your shoulders. Let it fall down, just like this. Fall down, off your shoulders. Just let it fall. Radiate down off your shoulders. Great. Now that you're comfortable, let's begin. The first thing we need to do is start by cleansing your face. By doing that, we'll give a spray, some exfoliant spray, and then we'll wipe it off your face, and then we will start the procedure, okay? Alright, so we've just got our exfoliant mist. This is the exfoliant. Okay, so just close your eyes and we'll just give a little spray. Get ready. Okay, great. Now, we're just going to come in with our scrubbing exfoliant cloth. So I just need you to be comfortable as I come in, okay? Just let that stress fall on your face as I clean and dry your face. Okay. I think I've got it just about dry now. Great. We'll get a new one of these afterwards. Now that your face is clean, let's get on to the first part of taking off that dead layer of skin and making your skin glow that beautiful hue that you've always wanted it to glow. So the first thing we need to do is get our tools. These are no ordinary tools. These are the best of the best. So, like I said, get yourself comfortable. And here we go. I'm just going to start on the top of your face. The noises, do not be alarmed, sound like just like that. Okay, here we go. So just coming in. Great. Just getting all of that face tended to. Does your skin feel better already? I'm going to assume that it does. Let's go back in just to finish off. Just wisping away those old selves, bringing on new ones. Great. On to the next step. These are very special. These are our healing rings. They just get placed right over your eyes, like so, like that. And you just hold them there and let them rest for 30 seconds. Okay, here we go. So you can close your eyes for this portion. Okay, so I'm just gonna come put that there and there, just over your eyes, like so. And let's deep breaths in and out. Great. 30 seconds goes by really quickly. As you can tell, we do have the airport is active tonight. Like I said, all the shops are always near an airport. It's just a way of bringing the clientele to me after a long airport ride. So, if you heard that airplane, that's why. Okay, let's move on to the massager. After the massager, this is what it'll help you feel like. Just a small little things like that, just around the face. It will feel great. So, close your eyes and be prepared for the facial massage. How does that feel? Good. I'm just coming up alongside of your forehead here. Just on that top part. Let's switch hands. How did that feel? Great. Let's go for another face wash, and then we'll be near the end. So close your eyes. Great. And we'll do a little clean off as well. Great. Moving on. Just these tools here really help underneath the eyelids to make them bright. So we've got our water, but it's no ordinary water. It's an amazing serum. So as you can tell, I've got more clients coming here right now. You can hear them in the plane coming to land. They're just about to land. So let's put some drops on. Really gotta douse it. Great. Okay, so just close your eyes. Great. One more time. Perfect. Just close your eyes once more. Okay. Just gonna get underneath your eyes there. And the other eye. Perfect. Your face should feel superb by now. If it doesn't, you can have all your money back because that was the 7-step extreme exfoliant face-over facial. So, with that being said, we'll do one little spritz, a wipe off, and then you'll be able to go to Margaret just at the front desk to pay. And if you didn't like it, you tell Margaret that I said it was okay. You don't have to pay if you don't like it. But if you do like it, by all means, you can pay Margaret. So close your eyes one last time. Great. And just one last wipe off. Get those last little stubborn spots. That person's just about to land in their plane. That's my next client. They're coming in hot. Hopefully not too hot. I need my building to still be here. Okay. Your face looks radiant. I really hope that you enjoyed yourself. My hands are now super clean as well. So, there's the door. And like I said, if you are not satisfied with this, you tell Margaret. Okay. Have a wonderful rest of your time here. Take care. Bye-bye. I hope you're ready for your massage. Are you comfortable? Great. Let's begin the full body massage. having been in this medical bed for so long already prior to your surgery that you're going to be commencing and having today. That's right, yes. Nothing to worry about for the surgery, though. I do, however, just need to go over an exam on you before we bring you in for that surgery. Sort of a pre-anesthetic sense exam, because we need to make sure that you're healthy so that when you go onto that table, you're in the best possible hands. But we need to make sure that your health is in the best possible way that it could be when you go into that room. Okay, so I'm going to be doing you took the words right out of my mouth, a cranial nerve exam. That's right. So, have you had one done before, possibly? You have? Okay, so you sort of know the process and the steps. Okay, I do them a little differently, but that's okay. It still is the process of the cranial nerve exam, just I have a unique set of utensils that I used in order to test those nerves. Okay, so first things first. Let's be sensible and safe and put on our gloves. Great. Yeah, I will be right back. Yeah, I'm back. Just needed to get a different set of gloves. These ones had ripped and they were in the cabinet over there. Great. So the first thing we're going to do is I want to make sure that your body is oxygenated. So I'm going to be using this nasal cannula and I'm just going to be putting it over you and I'm just going to be administering some oxygen to you. I do apologize. This hospital is near an airport, so if that's what you're hearing right now, it's temperamental. It's temporary. It's okay. So let's focus on this. So I just need you to be comfortable. I'm going to put this down and into your nostrils, just this nasal cannula here, and then we'll get on with it. So just tilt your head up for me a sec there. Great. Okay. Just gonna place that just inside your nostrils there. Okay. Okay, now let's turn on the oxygen. Just gonna turn that valve. Okay, you should feel some oxygen going into your nose. Do you feel that oxygen going into your nose right now? Great. Okay, yeah. I'm just gonna make the line go down and around so that it's not fully on your body. I need to be able to see what I'm doing here. Okay, now that you're comfortable, you're oxygenated, or you're getting oxygen, let's start this exam. So the first thing that I'm going to be doing is just having a feel around your face, just looking for any lumps and bumps, and then we'll get on to the cranial nerve portions. So I'm just going to come in here. Now, I want to make sure, are you alright with me coming in? I'm just going to be feeling around your neck and everything. Is that okay? Good. Okay, so I'm just going to be feeling around the sides of your jaw. And just coming down along your chin. Okay, just back up. Feeling along your forehead. Great. No lumps and bumps there. I like what I'm seeing. Just going to feel down along your Adam's apple now. So just tilt your head back for me. Just feeling down. Okay, I'm just going to put my hand on your Adam's apple. Can you swallow for me? Great. Thank you. Okay, so no lumps and bumps. Let's get into this portion. So the first thing that I'm going to need to do is I'm going to be looking at your eyes today. So I'm going to be doing a series of movements. I'd just like you to follow along with them. Blink as normal as you'd like. If you feel your eyes becoming watery, we can take a little break for a second. So I'm going to be looking at the dilation of your eyes right now on your left and right eyes, okay? Okay, so just be normal, blink as you need, and then look at the light. Okay. Okay. Pupils equal and reactive. this side. Just follow along, okay? You won't know where I'm starting from, but just do your best to follow along. Follow along. Keep following along. Great. Any pain or discomfort there as we're doing those eye movements? No? Great. We're going to do a little series of tests where you follow my fingers. You tell me when they get blurry or when they become in focus to you, okay? So first of all, just follow my fingers here. Now, when you're looking at my fingers, are they focused? Are they blurry? They're focused, okay. Now, as I move them away, do I become in focus? Let me know when I'm in focus. I'm in focus now. Okay, good. I like that. Your depth perception is good. I'm going to start on the outside out here. You let me know when my hands become in focus. Okay, so as I come in, let me know when they're in focus. They're in focus. You can see me moving them. Great, and I'm going to come back. Tell me when I'm in focus. I'm in focus. Great. Depth perception. No problems there on that cranial nerve exam. I do apologize. It must be a busy day at the airport. There are just a lot of planes taking off today. Let's do our best to just concentrate on each other during this cranial nerve exam. Okay, so I'm going to come back in. I'd like you to look up for me as I examine your eyes, okay? So just tilt your eyes. This is where I need you not to blink. Actually, what we can do just to help open your eyes more is I've just got some medical tape. I'm just going to tape up your eyebrows right there. Okay, that one. And just tape up this eye as well. Okay, great. Eyes are a little open now, I can see that, but that's okay. It helps me look into your eyes more. So, as you're looking up now, please. Alright, and looking up. Looking up, thank you. Looking down now. Looking down. Keep looking down. Okay, looking up. Okay, looking down. Looking down. Great. Not seeing any macular degeneration or anything. You must eat a lot of carrots and get your vitamin D, don't you? You do, good. My assistant is just calling me. I will be right back. I do apologize about that. Being one of the only doctors in this hospital, I get called on a lot, so I do apologize. Now, where were we? Just doing the eye exam. Okay, so now that we've done that portion, I'd just like you to just let me know. I'm going to put up fingers at random. I'd like you to tell me how many fingers there are at a time. Okay, ready? And how many fingers? And how many fingers? And how many fingers? How many fingers? How many fingers? Great. No problem with your counting there on that cranial nerve. So, like what I'm seeing so far. Now I'm going to be coming into your ears now, and I'm going to be listening to your left and your right ears, doing some audible tests. You let me know if you're having any troubles hearing. Okay. All right. So I've got a new device that I've got. It's quite a nice device. It's very simple. They are medical grade pens, but they send out, my language today, they send out audible noises that are quite nice to listen to, but they help me help you to know which ear we're out of. So you let me know which ear you're hearing it from. Which ear was that? And again. Which ear? Great. Sorry about that little frog in my throat. Now we're going to come in and do it again. Let me know if it's equal in both ears. Was that equal in both ears? It was. Great. That's excellent. I don't need to do really much more of the hearing test on that. That's more just to make sure that your ears are working. So what I'm going to do is I'm going to be doing the prick test where you let me know whether it's sharp or soft on select points of your face. I've got an item here. It's not super sharp, as you can see. It's just got a little bit of a point on it. And then I've got a Q-tip. Just your standard Q-tip. You let me know when it's sharp and when it's soft, okay? I'm not going to tell you what I'm doing. You let me know. So I'm coming in on your left cheek here. So here we go. And was that pointy or soft? Okay. And we'll do it again. And there we go. Pointy or soft. Okay, so you're doing well so far. And pointy or soft. Pointy or soft. Great. And we're going to do the right cheek now. Pointy or soft. And again. Pointy or soft. Okay, here we go again. Pointy or soft. And again. Pointy or soft. Great, you only got one wrong. I forget which one it was, but I remember that you got one wrong. All of the rest were right. Now, I'm just going to be coming along down onto your shoulders and into your arms a bit, doing the pointy and the soft as well. So you let me know. Okay, so ready, and pointy or soft, and pointy or soft, and pointy or soft. Great. On to the other side. Pointy or soft. Pointy or soft. Pointy or soft. Great. Cranial nerves are intact. Now, I want you to just open your mouth. I'm just going to have a quick little look inside. I do apologize. I've seemed to have split my glove open. I'm just going to make my way back to the cabinet and just grab another glove. 1 second. Okay, I'm back. Sorry about that, but safety is paramount here, so I needed that new glove. Now, where was I? That's right, I was going to get you to open your mouth so I can just have a little peek inside. Okay, so just nice and wide, go ah, and stick that tongue out like this. Ah. Great. Good, perfect. Yes, I saw those lights as well. Those are the ones I have in the back, so I can really make sure that when I'm looking in your mouth, yes, that one there. That's so I can really see in your mouth quite well. Okay. Can you move your tongue to the left? And to the right. Tongue, top of your roof of your mouth. And can you put your tongue into the bottom? Yeah, just like that. Excellent. Wonderful. You are an A+ patient at the moment. So a couple more things I forgot to do on the eye test. I've just got my simple eye tool here. You just let me know if I become blurry when I cover one of your eyes, okay? I'm coming in on the left eye. Now, coming close. Am I blurry? Oh, I'm still not. I'm not blurry. Good. Now, the other eye. Am I blurry? No. Excellent. I love that. I'm going to be coming in. I'm going to cover both eyes, and then I'm going to remove it super quickly. You tell me if I'm blurry or not. So, covering your eyes now, and then I'm going to let go, and then you let me know if I'm blurry or not. Was I blurry? No. I was always in focus. Great. Your eyes react to light very quickly, sort of like, just like that. That's great. Now, on to some of the color tests that we have before I listen to your heart. Yeah, a very important thing to listen to, but we're just going to make our way down. So, I've got an array of colors. Very simple. You just this. Lastly, this. Now, you tell me, how many colors do you see? Very quickly, you have to tell me, how many colors do you see? I'll let you focus. Did you get it? Yes, the answer was 5. Great. So, color test. I like what I'm seeing. I'm going to do one final test. It's just going to be on the back sides of your ears with my audible tools. Let me know if you can hear these noises from the back side of your ear when noises aren't coming in, like these planes above us today. Okay, here we go. I'm just going to come in behind your ears here. Let me know if you can hear them still, okay? Could you hear that? I'm coming just behind your ears again. You can hear that? Okay. And now I'm going to come from behind your ears forwards. You let me know when it becomes more audible as opposed to less audible, okay? All right. Now, it was more loud then. Okay, we'll try that again. Tell me when to stop. Same spot. Good. Your ears are excellent at listening. Now, how's that oxygen doing in the cannula that I gave you in your nose? It's doing good. Okay, yeah. Your surgery's in about 25 minutes, so I'm just going to do the last test here, listening to your heart. A couple breathing techniques to make sure that your lungs are okay, and then we'll have you on your way. Okay, so, I do apologize. It's a little cold. Okay, I'm just going to come in here now. I'd like you to just breathe normally. I know that when we say to breathe normally, you start to nod. So just pretend like you've won $50 million and you're spending it in your head. How's that sound? Great. Okay, so just going to listen to your heart now. Excellent. I like what I'm hearing, a steady beat. Now, I'm going to ask you to take some deep breaths in. I'm going to be listening to the upper, middle, and lower quadrant lobes of your lungs. Okay, so deep breath in for me, please. Thank you. And in. Hold it. Okay, and out. And again, in. Hold it. And out. Last one, in. Hold it. And out. Great. We're going to do the other lungs now, the other side. Deep breath in. Hold it. Out. In. Hold it. Out. Last one. In. And out. Sorry. In. Hold it. And out. Excellent. Your lungs sound great. No cackling. No whispering. It's wonderful. They're equal on both sides. I like what I'm seeing and hearing. So, with that being said, I'm going to give you the full health of Bill here before I send you off to Margaret, my assistant, where she'll just give you all the details of what the surgery will entail. When you're done the surgery, I'll be coming back to follow up with you. Maybe not right away, one of the other doctors will, but I'll be following up with you in a few weeks about this surgery. And that is right, it is a surgery. You guessed it, we did cranial nerves. It's on your brain. So the next time I see you, you'll be coming back for that post-op checkup from the surgery that we're doing inside your brain. Do you have any questions? No questions? Okay. Now, the last thing, it was a memory test. I just need to ask you a couple questions to see if your memory is intact for that last and final cranial nerve. Starting off simple. Do you remember your name? Good. Do you remember your age? Good. And your year of birth? finish off all of the rest of the preliminary things to get done. A little bit of paperwork, some signatures, and I'll be seeing you in the surgery room. Take care. Bye-bye. You're in for a deluxe special treatment today. We are going to be tracing your face in extreme detail. Get yourself comfortable. Sit down, relax, be comfortable. This will be detailed. So, I've got my trusty light here, as you can see. Turns off and on. I'll be using it to trace your face. Let's get into it. So we are going to be starting at the top of your face, moving down, and then going over every feature that you have. If you have glasses on right now, take them off. If you don't, that's totally fine as well. Here we go. I'm going to be starting from the center and moving out in either direction and then going up and down. Here we go. So, just with your eye right there, just going in a nice circle around your eye, and then going in close to your eye and out. Moving over to the other eye, in close, circular motions, and then in as close to your eye as I can get, coming out like so, going back in to your second eye as close as I can get. It almost becomes blurry. I get that close. Moving on to your nose. I'm just going to get close to it. Just getting close to your nose, just like that. Going down the bridge of your nose, your nostrils there. Going around the little outsides of your nostril on a little ballpoint piece just on the end right there. Coming back up your nose to your eyebrows, that center point just between them. Turning the light off. Going back on and then going to the left, your left eyebrow, just over like that. Back to the center. And again, over on the right eyebrow, following along to the edge, like so. And then back over to the center. How's that so far? Great. Let's move along to the sides of your cheekbones, down to the center of your chin. Just starting in the center point here, and then moving to the outside, down your jaw, cheek side, to the center, coming to that center point. Back up your jaw on the right side, and then going up alongside to the top of your forehead. You have a great facial structure. Now that we're at the top of your head, let's go along your hairline. So just starting at the top there, following along that hairline, just like so. And then back over, following along, making our way back down that side, on the left side of your cheeks, towards your jaw, down to your chin. Back over to the right side, up that cheekbone, up the side of your head to the other side of your hairline. Your face is very symmetrical. I knew that you knew that. I just wanted to tell you. Let's start in the center again and make our way down to your mouth. Starting in the center, making our way down to your mouth, just along right there, going to the left, and then to the right, going just up a hair to where your nostrils are, and then making our way around your lips, just like that. The ambiance of that helicopter that you can see and hear just makes it that much more relaxing. So following along those lips, circular motions around your lips. That second line just in the center where you can open your mouth. Let's go along that line right there like that. Let's go on the top of those lip outlines again, just on that little tiny little bump just on the top of our lips there, and back down along the bottom side of our lips that creates our mouth. Excellent. Now let's go along the ear and then the whole top portion of your head. Okay, so starting in the center again, coming out, going to the left, going up the side of your head there, right there, and then going around your ears just like that. Exactly, going around them sort of in that circular motion, just like this. Circular motion following that ear line. Going to the other ear, following in the center, coming out to the right, tracing around that ear just like so. You have very symmetrical ears as well on both sides. Let's go around to the top of that right ear, to the very top of your head right there, right on that hairline, making our way down and around that circular motion of your face. Your face is amazing. Let's go down your neck. Okay, so starting in the center, coming out, let's go down the left side of your neck, just like this, along that clavicle shoulder. Coming back up that left side of the neck, moving to the center, just where our Adam's apple is, and going down that Adam's apple, just like so till you can't see the light. Coming back up, moving over to the right side, going down the right side of your neck, along that right clavicle to the shoulder, till you can't see it anymore. How are you feeling? Are you feeling relaxed? Great. I'm going to come up to your eyebrows now, and we'll trace out your eyebrows. So, back to the center. Out. Up the bridge of your nose. Around that left eyebrow, just tracing so gently around it. Just gently tracing around your eyebrow to that center point again. Let's do the other one. To the center and out. Up the bridge of your nose. Tracing around that right eyebrow like so. Just following that eyebrow. Can you feel that? The warm light around your eyebrow. Great. To the center. Let's do that again. We'll start with your eyes. Coming into the center and out. Up the bridge of your nose to that left eye. Tracing it. Those nice sharp points at the very edge of our face. Creating that teardrop-like look in our eyes, just like that. Wonderful circles. As we get close to your eye, just let the light hit your eye and be relaxed. Great. Let's do that to the other side. Coming in and out, tracing that teardrop of an eye, just like that. Teardrop down and up, just like that. Symmetrical eyes that you do have, following along, going in circles around those eyes. Coming in, following the light, and back out. Let's take a deep breath together now. Deep breath in. it out. We're going to go to the nose again. Coming into the nose. Going up the bridge on the top, just like so. Back down. Along those nostrils. On either side, left and right. Going to that center point just there. On our nose. Following back up the bridge of your nose to the top of your forehead. Following along the hairline on your forehead to the left, down and around the side of your left cheekbone, down towards your jaw and your chin in the center. Now the other side, continuing from the center of your jaw to the right side, to your right cheekbone, up the right side of your head towards the top of your hairline right there, and following along till we get to the center point of your symmetrical face. We're going to go from the center of your forehead all the way down. Follow that light right down the bridge of your nose towards your lips, creating those lip-like structures. The bottom side, along the center right there, that center line of your lip, creating the top portion, that little divot right there, and down, circling around your lips just like this. Can you feel the warmth of the light on your lips? Great. Let's take a deep breath again. Hold that breath. Let's go down the neck and the shoulders again. Starting off on the left side. Left down along that left neck to the left clavicle, to the shoulder, and let it drop. Down the right side of your neck. Let it go down along that right clavicle till you can't see the light, and let it drop. Coming into the center of your neck along your Adam's apple area, underneath your chin, just like so, following along that center line of your neck until the light disappears. I hope you've enjoyed our session today of tracing your face. You're always welcome to come back and have your face traced whenever you'd like. Until then, I'll see you next time. Bye-bye.